Are you a snorer? Do you wake up feeling exhausted with a headache? When you try to fall asleep at night, do you have a compulsion to wiggle your legs and it keeps you from actually going to bed? This video is about disordered sleep. And if you'd like to learn more about disordered sleep, how to identify the problems and how to beat them, stay tuned, because I'm going to start that learning right now. Howdy. Thanks for learning about MS with me, Boster. I started this YouTube channel to help my own MS clinic patients learn between visits. And it's my hope that through these videos, I can help you learn too. Today's topic is disordered sleep. Now, sleep is critically important for all human beings, and it's particularly important for people with multiple sclerosis, who suffer from a shrinking functional reserve and need to recharge their battery every night as much as humanly possible. There are innumerate things that can mess up your sleep, and I have several YouTube videos already on this topic. I'll throw a card up above, and I'll include in the links down below in the description a couple of those videos in case you want to check them out. This video is going to focus on two areas of disordered sleep that are culprits for interfering with the quality of people's lives with MS. The first one, obstructive sleep apnea, and the second one, restless leg syndrome. Now, these are sleep disorders. In other words, this is not a symptom of multiple sclerosis, although people with MS can develop obstructive sleep apnea, OSA, and restless leg syndrome arguably more frequently than the general population. And so I want to deal with each one of them in turn so that you're sensitized to them, you know what to look for, and if you're noticing problems which sound like obstructive sleep apnea or restless leg syndrome, then you're ready to talk to your MS provider about how to improve your sleep. So let's get started. When you sleep at night, all of the soft tissue of your neck relaxes. And that includes the muscles that keep your windpipe open. If you have a certain anatomy, and when you relax, all of that collapses too much, it can actually close the windpipe. And when you're asleep trying to breathe, you have to move air through a collapsed tube. That sound, that snoring sound, are the tissues vibrating back and forth as you try to move air back and forth. Now, if the obstruction's bad enough, it can literally interfere with your ability to get oxygen. And what typically happens is people don't enter into deep restorative sleep. Because of the lack of oxygen, they are brought awake. Now, not awake to where they can say, "Hi, how are you?" but awake out of restorative sleep into very, very superficial sleep, which is not restorative. Now, this problem can be quite severe without people being fully aware of it. And a bed partner might notice what we call an apneic episode, where the person sounds like they're not breathing because they're not. When we send a person who has symptoms like this to a sleep lab, sometimes we'll discover that even though that they're in bed with eyes closed for 8 hours, they're actually only getting 2 hours of restorative sleep. So obviously, this problem, called obstructive sleep apnea, is a major and serious one. Think about this. People with MS wake with the most amount of energy they're going to have all day. They wake with all their spoons, and as they spend energy throughout the day, as they lose spoons, they become quickly fatigued. But they wake up with energy. People that have obstructive sleep apnea are not getting adequate restorative sleep at night. When they wake up, they do not feel refreshed. Oftentimes, people with obstructive sleep apnea, they wake up, they're exhausted, and their head hurts. So, if you are a snorer, if you're noticed by your bed partner to have apneic episodes, where you wake yourself up, if you wake not feeling refreshed, and if you wake with a headache, I think you need to talk to your MS provider about the possibility of having obstructive sleep apnea. Now, the second topic for disordered sleep is restless leg syndrome. Restless leg syndrome is super, super annoying, and it's best described as a compulsion, a need to jiggle your legs. It typically occurs when things are quiet and you're at rest, like when you climb in bed to go to bed for the evening, and you're laying there still, and you develop a need, a compulsion to wiggle your legs. They feel really, really weird. And eventually the compulsion builds up and you voluntarily shake your legs and they feel okay for a split second. This will oftentimes interfere with someone's ability to initiate sleep, and people will jump out of bed and walk around because their legs feel funny and they get back in bed. Now, this is all too common, and it can really interfere with sleep initiation, leading to not a very nice night. If you're noticing that when you lay in bed, you have a compulsion to move your legs, you've got to jiggle them, then you may very well have restless leg syndrome. And I want you to bring that to the attention of your MS provider. There are several avenues of investigation, looking into iron levels, looking into medicines that can treat these symptoms, which can really improve the quality of your life. Once again, my name's Aaron Boster. Thank you for learning about MS with me. I spent a few minutes today talking about disordered sleep, specifically obstructive sleep apnea and restless leg syndrome, both of which are common amongst people with MS, and both of which can erode the quality of your sleep. If you think that you may have these symptoms, I certainly encourage you to reach out to your MS provider. I would love to hear from you if you've experienced these symptoms, if you've sought treatment, what the outcomes were. Please leave those comments down in the section below. And if you'd like to see more videos just like this one, please consider subscribing to the channel. Until my next video, take care.